Hi everyone, welcome back to the vlog. Throughout this series, we've talked about different challenges when it comes to navigating hand therapy as a new graduate and finding your place as a new clinician. Today, I want to talk about something that I think a lot of new graduates experience, but hesitate to talk about so openly, and that is feeling the need that you have to prove yourself as a therapist. When you are a new graduate, especially when entering a specialized field like hand therapy, there can be this added pressure to prove that you belong there. You want your coworkers to trust you, you want your patients to feel confident in you, and you just want the people around you to know that you're capable of doing your job. And I definitely experienced this too. Early on, I fell into the mindset that I need to prove what I was doing. I strive to have the right answer. I always want to make the perfect splint, and I found the need to prove myself to answer things independently because I thought that's what a good therapist looked like. But something that I've learned throughout this past year is that constantly trying to prove yourself can actually get in the way of your own growth. The truth is, you're not going to learn if you're afraid to admit that you do not know something. A big shift for me was realizing that asking questions, acknowledging my own mistakes, and being open about the things that I don't know did not make me look any less capable of being a hand therapist. Those three things actually made me a better clinician. Some of my biggest learning moments came from me taking a pause and asking myself, I'm not sure, let me look into this, or let me get a different perspective on this. And those moments are not failures. Those moments are clinical reasoning, and that is how you grow. Something my mentor always reminds me of is that you do not have to know everything. And I think that's especially important in hand therapy because this field can be incredibly complex. There are so many patient situations that you cannot fully prepare for until you experience them yourself. The goal is not to walk into every situation and know exactly what to do. The goal is to be confident and recognize when you might need a little help in those situations. And I think that mindset shift actually changed the way that I approach my patients too. Instead of just focusing on if I looked like I knew what I was doing, I would focus more on how to actually approach a situation and what can I learn from this, which then in return led me to know what I was doing. True confidence is not pretending like you have all of the answers. It's trusting yourself to know when it's okay to ask for help. It's being willing to learn, and it's being comfortable with the fact that you are still growing. The clinicians that you look up to are not great because they've never made any mistakes. They're great because they've learned from their mistakes. They've learned from challenging patients in every situation that they had to face when they were new graduates and new therapists as well. So if you are early on in your career and you feel like you're constantly trying to prove yourself, I hope you know that you're not alone in this. Give yourself permission to be a learner. That's not a weakness, it's how you become a good clinician. I would love to hear from you guys. What is something that helped grow your confidence as a student or new therapist? Thank you guys so much for watching. If there's anything you'd like to hear in a future episode, please drop it in the comments below. I'll see you guys in the next one.